I don't want to blame you for the guidelines.
Pardon?
Hello, cousin.
Oh,
I don't want to blame you for the guidelines.
thank you.
But
Yes.
the guidelines are suffering from magical thinking. I mean, we're taught something very different here.
In terms of?
I'm going to tell you.
Okay, thank you.
You're telling us to do something that we know doesn't work. Because when you lose weight, right, when you restrict calories, you increase your ghrelin and you get more hungry. And eventually, you can't maintain the weight loss for 95% of the people. Now, what programs work? You have to have a program that has satiety. Okay? You are giving us a program that does not give satiety. In fact, we know the program you're giving us is going to cause a lack of satiety. Nobody can live with that except maybe 5%. So this is magical thinking to keep telling us to do the same thing that has not been working.
So you feel that the evidence suggests that ghrelin alone levels is what's driving the difficulty in maintaining weight loss?
You know, I'm trying to keep this simple. Obviously,
right.
In this course, Liddell is telling us that it's the resetting of the threshold of the leptin that is one of the main components. I also think that because of metabolic syndrome and insulin resistance, that when you have very high insulin levels, that when you have all those fat cells that never go away with the diet, that they are prone to get fat because of all the dyslipidemic effects of the insulin. I mean, I don't want to, but you guys don't address any of that in the guidelines. I mean, I come to this course to learn this, so I'm saying you are suffering from magical thinking, and I point to the Look Ahead trial as evidence of this. 8 years, millions and millions of dollars. You got a 4% weight loss. The control group had a 2% weight loss, and the primary outcome was negative. And yet you're still selling, go on 500 calories less, lose 3 to 5%. It'll all be good down the road if you just stick to the program.
Well, and I think that's an interesting perspective on the whole field. I think the difference between guidelines, evidence-based guidelines, and other types of recommendations is that evidence-based guidelines are based on very specific criterion, and it means there has to be strong evidence to support it. We all have our opinions, and I have my personal opinions also, and we all have our own areas of research, and we all think our areas of research and our findings are more important and hold more water than anyone else's. However, at this point, unless there are good multiple randomized controlled trials to show that one factor is more critical than another factor, we can talk about it, we can look about those individual studies, but they don't meet the criteria of evidence-based guidelines. And that's the difference. As far as the Look Ahead trial, actually that's an interesting one, and I have a PhD student who's actually looking at subgroups within the Look Ahead trial. So there was a significant weight loss, and then there was a rebound and a weight gain. And trying to segment out those individuals who lost weight and were successful in keeping that weight off versus those who did not. Because what we're looking at in the Look Ahead, and I think that was a surprise to everyone, but it was very, very important to have done that, is we don't know within those subgroups what was actually happening. Until we understand that, I don't think we can draw any conclusions from that.
And then we
got a lot of people.
I know. I want to thank you for your work. I want to let other people say, but your answer was not satisfactory.
Okay. Yes.
For another